Many of these children I see right after birth because their parents express concerns about the absence of an ear canal or an outer ear, or their hearing exams are abnormal. Once we establish that this child may have a hearing loss that is amenable to a bone conduction hearing aid system, most of their care is then delivered by the audiology team because they're the ones who'll see them regularly, every 6 months, every year, to test their hearing, obtain the devices, adjust the devices, fix them if necessary. Generally, for the bone conduction systems, I will then reacquaint or reconnect with the children as they get to that age when the families are thinking about surgery. So starting between age 4, 4.5. If we deem the child an appropriate candidate for surgery, then there is a workup that we do. We get a CT scan of the head to really identify the anatomy of the inner ear, because that also gives us information if they might be a candidate for other types of hearing rehabilitation outside of bone conduction devices. Once that's completed and we review it and we find that surgically a patient is a candidate, then our families will meet with our implant psychology team. And this is an interview and a meeting with dedicated psychologists that we have within our department. The psychology team is there to really clarify and monitor how the family responds to these devices and their understanding of what it means to take care of a child who has this, and if they're also able to take care of these devices and advocate for themselves. Once that's cleared, then we set up the surgical date. After a surgery for bone conduction hearing aid systems, the recovery is quite simple. The incisions that we utilize to implant are quite small. Children have very little pain. There is a minimal dressing over the device immediately postoperatively. Children go home same day for the most part. Many parents will report that their children act as if nothing ever happened 1 or 2 hours after the surgery. There are some stitches that are involved with closing the incision, but those are all dissolvable, so there's really no care that the parents have to perform postoperatively. We see them back 1 or 2 weeks back to make sure that the incision heals well. Depending on the child, the surgeries may be done either in a single stage or in 2 stages, in other words, 2 separate surgeries, and that's all dictated by the health of the child, the age of the child, and the particular reason, the medical history for which we are actually performing that surgery.